Dr. Kevin Kavanagh. He's a retired physician, also founder and president of a national organization called Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
How are you today, sir?
Oh, doing really well, sir.
You sent some information here just last hour. I'm assuming, is this nursing home information something that's new?
Well, yes, that's the Kentucky nursing home, which was reported in the CDC on Thursday. And there's been a lot of press on this, some of which I think is very constructive. Others, I would venture to say, even borders on being a scare tactic type of a thing, where it's really alarmist and creating undue distress, which is kind of disappointing. I think that people need to realize that although people who were vaccinated did develop the infection, that's kind of how vaccines work. It doesn't mean they got very sick, although some did, but it was much, much less likely to get sick if you were vaccinated or to become hospitalized if you were vaccinated compared to those who were not. And that's the important take-home message, is that unvaccinated residents and staff were at least 3 times more likely to become infected, and they were also more likely to become hospitalized. And that, to me, really does show that even with this variant, the vaccines work. The other thing I should note is that there is a kind of a scary headline, well, one person was vaccinated and died. You need to remember this is a very elderly, at-risk population. And the person who died was also in the group that had a reinfection. So I would interpret the data that this person at one point had COVID, plus was vaccinated, plus still developed a severe infection. You may be looking at someone who's very immunocompromised. In other words, that's not an individual you would expect the vaccine to be working in. So overall, this study really does drive home that if you're going to be living in Kentucky, and we now have these variants coming in, you need to get vaccinated, and you need to get both doses of the vaccine. That is key. One dose will not help you with the variants, at least not these level 2 variants that have the E484K mutation. That's the vaccine or immunity avoiding mutation. So it's all up to us. The bad news is we've got variants and it can cause more disease and be transmissible. The good news is you can prevent that with vaccines, or largely prevent it. And we have appointments available. Go out and get vaccinated. It's all in your hands. So let's do that. And let's get ourselves out of this predicament and get back to a more normal way of life.
Well, as you say, the headline on the front page above the fold, the Lexington Herald-Leader this morning says 18 vaccinated residents catch COVID-19 in nursing home, 1 dies. That sounds pretty scary.
Well, it is, but there were 83 residents, 90% were vaccinated, and that's 18 out of 70 plus people who were vaccinated. In nursing homes, that's like a petri dish for this virus. This virus aerosolizes, it floats around in the air, and it probably exposed everybody to the infection. And only 18 vaccinated residents developed the virus. But that doesn't mean they were severely sick or symptomatic. Remember, the vaccine works by killing the virus in your bloodstream. So oftentimes you will get it to reproduce and spread within your nose. You don't get symptoms. You then snuff it out. That's kind of how it works. But yet you would still develop a positive test. So I think that although people did become sick, they were much less likely to be hospitalized if you were vaccinated compared to not vaccinated. Certainly, the vaccine is not as effective as with the wild type of a virus. And certainly those people who were infected could spread the virus. So the other message is, if you're vaccinated, you still should be wearing a mask because you don't want to be spreading the virus to others. And many people will call up and say, well, what about with your family? Why do you say one thing with your family and one thing out of your family household? Well, the reason is pretty simple. It has to do with relative risks. and whether or not you are willing to take the risk. If you have family members come in, they're vaccinated, you're vaccinated, you may have grandchildren coming into your home, the chances of transmission, of course, are there. But everybody in that unit knows it. They've accepted that risk versus the benefit of the vaccine. But if you're going out in public or you're going into a nursing home, you're now putting that risk on others. And that's really not up to you to decide. And that's why you should be wearing a mask. It is to protect and respect others. And when you look at a nursing home, you've got the highest risk, most frail residents. Certainly we need to protect them. And that should be what our country is about, not exposing them to unvaccinated individuals.
Okay, let's go to the text here. Auto text service text line. Got a bunch of them for you. This is from Bill. Can COVID-19 vaccine cause you to lose your taste and smell?
The answer to that is no. It does not cause an infection. Losing your taste and smell is actually caused by the coronavirus infection. Taste is actually mostly smell. If you lose your smell, it changes the way you taste food. That's hard to explain to people, but that's the way it works. And the smell type of a nerve is actually a projection of the brain. So when that nerve gets infected, it's actually the brain getting infected by COVID-19. And that's one of the reasons why you're also hearing a lot of associated CNS symptoms or psychological symptoms, brain fog, memory problems that goes along with this long hauler syndrome.
All right, would like Dr. K to address which institutions recommends should we value more the CDC or the WHO? They've had conflicting opinions, so just looking to see which one we should listen to.
Currently, I'm listening to the CDC. I think that their advisements are more on track, but you will also find independent, non-governmental scientists, such as from the National Academy of Science, which also come up with some very good recommendations that we should be listening to. One of the things I do not like is that we do not have enough emphasis on aerosolization and spread of this virus. And this is something the National Academy of Sciences has been stressing. This means that we should be getting N95 masks. Currently, they're available on Amazon. It means you have to be very careful in indoor settings. So aerosolization is something we need to pay attention to. That's also why outdoor settings is safer than indoors.
Okay, if you are fully vaccinated and you get the virus with mild symptoms, what is the treatment being used?
Currently, I think it will be isolation and careful following. I would not suggest getting any sort of additional antibodies at that point, but it would be an option. You could also get monoclonal antibodies, but I do think absolutely need to call your physician because you want to make sure you're not infected with one of the variants. And that is something you'd want to do is get that sequence. So let me just state, call your doctor.
Did the report, we're kind of looking here, Dr. K, is there any indication in that report about that nursing home, where it is and what it is?
No, they just said Eastern Kentucky. But I am disturbed about the headline. I think that's going to fuel vaccine hesitancy. I mean, it could easily have said vaccines shown to be highly effective, even with South African variant, because that's the same mutation this has. If you look at the residents, and I did some math, and that's always dangerous for me to do math over the break, but for those residents that were vaccinated, 2.7% were hospitalized. For the residents that were not vaccinated, 48% were hospitalized. And these are very high-risk individuals. So this vaccine is highly effective in that group of patients. And, to be scaring people on the vaccine, I don't think is good. And like I said, the one death, if you read into the data, was also a person who had COVID before, probably someone who was very immunosuppressed, so you wouldn't expect the vaccine to work. So the vaccine, let's get it. This, I think, was a positive report. It is a cautionary report because if you are asymptomatically infected, which people were, you could still spread the virus to others, which means you're going to have to wear a mask with these variants. But it's not something that should discourage people from getting the vaccine.
All right, this came in earlier in the hour. Ron V says, by that logic, we'll be wearing masks forever as risk mitigation. Is that reasonable or no?
Well, I'm not sure, but it may become part of our life for wearing masks in certain settings. This is one of the reasons why early on I wanted to snuff the virus out. In other words, do an eradication strategy rather than a mitigation strategy, making things better and we can, keep the cases down and try to keep the morbidity down. Certainly mortality is falling, but morbidity, in other words, chronic long-term effects, the more and more we're learning about that, the more and more concerning those are. And there's also a new report out in Nature on that, which shows that there's a 59% increase in dying within 6 months of contracting SARS-CoV-2 virus. And that's in mildly infected individuals. And that increases the mortality rate for COVID overall by 0.8%. So this is a huge, long COVID is a severe problem. And so we need to really pay attention to trying to keep this virus under control. The people that are saying, oh, you live, everything's fine. Well, whether or not you survive or actually live from an infection is a pretty low bar for community health. We need to try to mitigate spread. And be honest with you, we've got this within our control. Just get vaccinated. It will decrease community spread enough, along with some simple public health strategies, that we may be able to snuff out this pandemic.
Here's another one that says, is there a test you can take to see if you have ever had COVID? Would that be the antibody test?
Yes, it would be the antibody test. And if you've been vaccinated, you can still get that test to see if you've had COVID, but it has to be a specific test to test for antibodies that are not the ones that are made by the vaccine. But they do have those, but you'd have to talk to your doctor about that.
All right. My brother-in-law, this is from the Auto Tech Service text line. My brother-in-law had COVID-19 3 months ago and lost his sense of taste and smell. Now he's smelling odors that are not there. What's your comment on that?
Well, that's very common. And sometimes you wind up smelling just rotten eggs. Because what happens is that the nerves in your olfactory bulb, which is that projection of the brain, and so they're not really nerves, they're projections of the brain, will go to certain cells in your nose that detect certain odors. And when you get that infected, all of that mechanism gets kind of destroyed. Well, it regrows, but it doesn't necessarily connect the nerves to the right place. So you may get a sense of a rose that's coming into your nose, but what you are smelling and your sensation is maybe the rotten eggs. And so people have a lot of problems with that because the nerves don't grow back to the right receptors. And so that can happen.
Here's another text. If you are fully vaccinated, what can you feel comfortable doing?
Well, I'm still cautious and I'm fully vaccinated, but I feel comfortable or more comfortable seeing my daughter, who's also fully vaccinated. They help to take care of us and are within our household. I feel more comfortable seeing my grandchild. Of course, my grandchild is not fully vaccinated. Do we still wear masks? Sometimes, but not always, especially if we're eating. We still go out together. We still play Pokemon together. So, that's something that really I think you can start doing. But until we know more about these variants and how they spread, what long-term effects are, I, for one, still want to side on the side of caution. And you need to remember that I'm in a very high-risk category. So I'm the elderly high-risk person who you have to be extremely cautious.
All right, let's go to this call. We'll just have a minute. John, real quick.
Yeah, I think Dr. Kavanagh basically just answered my question because we have great nieces and nephews who are not vaccinated that we were going to be around. We are both fully vaccinated, and we're just wondering how comfortable we could be in a inside setting that's just going to be with vaccinated people other than the children.
Yeah, and there's risk. There's risk versus benefits, and that's what you have to weigh. I haven't seen my grandkids in a year. That's long enough. I'm elderly. I could die in a couple years. I want to do that. But again, that's not the same thing as going into a box store and doing that and imposing that risk on others. So you have to look at risk versus benefits. Nothing now is for sure, this is safe, this isn't safe. Everything has risks, and you have to yourself decide whether that risk is worth taking.
I appreciate your call, sir. Unfortunately, we're out of time. As always, Dr. K, we appreciate you very much, and we hope you have a great weekend.
All right. Thank you, Jack.